There's now a sudden interest in brain aneurysms after Kim Kardashian revealed yesterday that she's been diagnosed with a small one. Aneurysms happen when a blood vessel in the brain bulges, but did you know they're actually, fairly common?
In fact, the American Heart Association estimates 3 to 5% of Americans have a brain aneurysm. So, of course, we had to bring in our 9 News medical expert, Dr. Payal Kohli, with more information. So, first and foremost, what is an aneurysm, and is it as common as we just learned?
In fact, it is. So we don't systematically screen people for aneurysms. They're generally discovered what we call incidentally. So you're getting a brain scan for some other reason, and they find this bulging. Now, brain aneurysms can be common, but you can actually have aneurysms or bulging any blood vessel anywhere in the body. The most common is our aorta, which is the biggest blood vessel that runs down our body. More common in women, more common after menopause. And so that's the reason we're really getting a lot of attention now, because Kim has raised awareness of this.
Is this something that grows over time, or is it sudden? I worked with a woman once who had one on the desk. She was healthy. A 50-year-old woman had one in her brain.
Oh my.
And it was just so sudden, and that's my knowledge of them. But is
So
it always the way?
She passed away?
No, she survived.
Okay.
She had surgery and the whole thing, but it was
Great.
just this crazy instantaneous thing.
Yeah, so think about it like a weakening of the blood vessel. So almost like a water balloon being stretched out over time. Now, there's genetic factors that make the water balloon more susceptible, our blood vessels. There's hormonal factors, like in women. Inflammation can cause it, smoking, alcohol use. But really what we worry about, Alex, as you said, are the ones that grow over time. Because when they grow, they can rupture or pop, and that can usually be catastrophic, life-threatening, because it's a closed compartment. If it's not deadly, then it leaves you with a significant stroke, morbidity, or mortality as well.